Okay, so as we move into our last one, I'll welcome Sander Ruitenberg to the stage. Welcome again, Sander.
Thank you.
Sander is Global Head of Digital Health Solutions, Immunology, Hepatology, and Dermatology at Novartis.
That is a big mouthful there. So I'm dealing with information overload, so I'm sure you are. But it's a pleasure to close the session. It's been also for me a learning experience, so it's been great. So I'm the head of digital health solutions at Novartis. There's a few of me. I work in immunology, hepatology, and dermatology. Before that, I was in marketing, and I also was working on some of our larger social media programs. Novartis, as you may know, has a big heritage in social media. And actually, my Greek colleagues can tell you all about that because they do some amazing programs. Some of that you can actually see here. I'll talk a little bit about that. But I'm also going to talk a lot about where we're going next. Because we have a big footprint in social media, but what do you do then next? Because we more or less know how to do that. We can do a lot better still, but where's the journey going? I've been on a journey of technology innovation to really figure out how we deliver that to customers. Patients has really been a focus, although we do also look at other, what we call users, like caregivers and HCPs, and even, of course, within HCPs, is it a prescribing HCP, a referring HCP? Is it a nurse? Is it a pharmacist? So maybe not segments of one, but certainly more segmented than we may have done it in the past. Novartis is reimagining medicine through data and digital, and you'll see that. But I want to stress that I'm also going to take you a little bit, or try to take you on my more personal journey of dealing with this since more or less 2017 in the way that I'm going to talk about. So when you think around connectivity, it's very important to also think around all these other companies that are thinking about connectivity. And here's just one example of what that means. This is going back to the 1970s, and this data is from 2017. It's probably even more now. If you think around how many ads are people seeing, and I got personally quite fed up for a while with my Instagram ads because it was getting so much. So just think of your personal experience with all the ads, if you're very connected on social media, that you're experiencing. Some are brilliant, some are just annoying. So the question is not only, what does that mean for an individual when they have so many advertisements and other communications, because on top of this you have the news and everything else that's coming your way. What does that mean for them? What is their relationship with all that information? But also, if you have something important to tell about a disease area or something else around digital health or health in general, how do you actually get your voice heard? And that's where targeting will come in. So the old ways are still very good to become personal if we do it the right way, but to be personalized and really get through to this person who's dealing with this type of noise, you could say, is actually quite challenging. On the other hand, that's an opportunity here, and it was mentioned before, people are amazingly connected. And there's just another number, just to sort of give you a feeling of what that actually means. This is from 2018, where 300 million more people were connected with their mobile devices. And in many cases, of course, those are very smart devices. They're mini computers. And the total number at that time was about 3.5 billion, and it'll be more today. So there is, on the one hand, this almost noise in the machine, and on the other hand, you do have the opportunity of this connectivity. The question is, how do we use it? What is our role also as pharma companies in this space? This is ultimately the conclusion. This sets the stage. People are more connected than ever. It's up to us to figure out how to use it. It's not really up to them. They can ask us, but we want to actually send information. We want to give them more awareness. We want to educate them. So we have to figure out how to actually use this opportunity that we have. So at Novartis, we're really focusing on data science and digital health. And I'm only showing you a small part of that because this is actually something that's a philosophy that's carried out throughout the company when it comes to reimagining medicine. So you'll see it in our supply chain, in our finance system. So some of the things that I talk about when it comes to digital health solutions are also happening in other parts of the company. So it really is a big culture shift. And if you hear our CEO, Vaz, speak about that, you'll really get a sense of that culture shift. But he'll also speak about the challenges of data, as was mentioned already, the challenges of artificial intelligence not being as intelligent as we would like it to be today. So we're really on a journey as a company, and I'm on a personal journey as well. But here are some things to think around when you think around connectivity and what technology can do. So 24/7 availability is a really important theme, and I'll speak to that a little bit. Real-time connections, how could you use those? People getting more informed. How can you actually get information that is more relevant, more credible, and more impactful? The availability of information, of services, of support definitely can increase with that connectivity. And then ultimately, ideally, we want to be valued. We want to deliver value and be valued as a partner in health, which was actually mentioned before. Like sometimes we're very distant as pharmaceutical companies from what's actually happening when it comes to information and services in healthcare. We shouldn't be shy about the fact that, of course, the goal is also to strengthen our brands and to also get customer loyalty. I think we should be open about that. Sometimes we are not transparent about what we're trying to do. We can do amazing things for patients, for caregivers, for HCPs, and we can also do amazing things for ourselves, and we should be very proud of that. So when you think around 24/7, it's really around the availability of information and services. With new technologies, and I'm actually going to show you an example of chatbots, but there are many other examples, this availability is really important. It's something that people will want, but it also comes with responsibility. If you are the first source of information that they can grab, it could also happen in a moment of need. So you have to, at some point, think around what that means, that 24/7 availability. It comes with responsibility as well. Real-time connections, a lot of that will be more data-driven, of course, as well. But actually, there was a great example about a real-time connection where someone can, through telemedicine solutions, hop in a box and talk to a doctor. That really changes a lot of things around what we see as problems in what we call the patient journey. The waiting times can disappear. What does that mean? We need to think around what that means for us in our company, in our disease areas, and how do our business priorities relate to that. Information, there's also misinformation. So if you go on the internet, not all the information you'll see is great information. It can be actually very confusing, and certainly our research shows that. So with that, there is also the opportunity to use data more intelligently, to deploy analytics. How can we do that in a way that it's not data overload? If it's confusing for us, it's certainly going to be confusing for a patient, and it's most likely going to be confusing for HCPs. So which data do we prioritize? How do we present this data? How do we help people understand the importance of data? Because we also want people to track data and measure things. I already mentioned the availability. It's not only about sort of pushing it out there and making it available. Can we help someone understand if this is relevant to them? If this is actually something that applies to them in their unique individual situation? Because we sometimes think of patients in groups, but they are living very personal lives. And so they don't, of course, think of themselves that way. And ultimately, around delivering value. And this is definitely something that's very important. The technology can take you anywhere. You can find 30 partners on any technology topic. The question is really, what is the problem that you're trying to solve for? Because that way, obviously, you'll deliver value. And then this is the goal that we've set for ourselves. So it's really around reaching more people. We really think that technology, data, and digital can do that. Expanding personalized access, so not only access, but making it more personalized. I already mentioned a few things around that. And improving the satisfaction. And rather than, let's say, clicks and other opening rates, satisfaction will have to become the ultimate goal. The challenge will be for us to be able to measure that, of course, within a very regulated environment. So that's something that we're thinking about in the background as well. Now, the opportunities in some ways are endless. The awareness is probably where we're the most familiar. A lot of social media programs are very focused on awareness. You can see a great example from the Greek team where they're presenting a fantastic campaign in AS, ankylosing spondylitis, and it's all about awareness. And they're actually using virtual reality to get simple messages across and drive that awareness. And that's still fantastic work. The question is, from that strong basis, how can we go further? And that's really where you get to the next chapter. So that's really now becoming more about identification, understanding much more about the individual users. So one of the things we're working on in Novartis is really to think around unique customer IDs in a compliant way, obviously, but how can we really understand the individual better? And how can we transparently build knowledge about them? And how can we actually motivate them to share data with us? Leading to activation. What are we actually trying to do? You can send all this information their way. Are we trying to get them to see a GP? Are we trying to get them to see a specialist? Are we trying to get them to track their disease better? Or are we trying all three? Maybe all three is a bit much, but at some point you can build towards it. And that then influences how we educate. A lot of our education has historically been very much a push strategy where we have, of course, done the market research. We know what we want to educate on, but it's very difficult for us to understand how that will resonate with an individual audience of one. That's sort of the follow-up phase. That's where we're focused at the moment. And then when you think of the programs, we invest heavily in patient support programs, medical educational programs. Have you truly thought through all these three phases? I see a lot of people focus very heavily on the middle phase of engagement. The research shows there's a big gap often in onboarding. Someone gets prescribed a new medication, they get put on a patient support program, and they don't even know why. In fact, they hardly know why they were prescribed the medication. They had 10 minutes with their physician in the office, they walk away, and they've forgotten 80%, Then they get onto a patient support program, and there's not always a proper onboarding. So that's actually your most important moment. It's your first impression of your program or medical educational program for an HCP. Why are they there? Why that content? What are you actually trying to do for them? Then, of course, engagement, first 1 to 2 years. That's traditionally more our focus, where we try to have a continuous flow of information. But then what about retention? What about if someone who's actually in your programs for much longer? They might be there for 5 years. You still want to connect with them. They certainly don't want you to do that every month. So you have to think of new ways to actually build up a more long-term relationship. We work a lot in chronic diseases. So for us, this is a very important aspect. And something we are thinking around more and more. And technology can help us do that. Actually, the Netflix example was great. Personal preferences in the future will actually help us design these journeys in a much better way. Sometimes someone only wants a reminder every 6 months. Some people may want them much more frequently. We're going to figure that out. We don't have all the answers yet. We just know what we're looking for. Then the final phase, this is more or less the holy grail. But of course, if you've done all that, you can become a little more ambitious. And that's really where the loyalty piece comes in, certainly if you're trying to build longer-term relationships with prescribers, but actually advocacy as well. More and more, we're speaking also about creating buddy systems. Can we actually connect patients with experience to new patients? And can we actually resolve some of these questions that they're dealing with someone who's much more like them and is much more able to make that more personal? And then finally, what I think is the ultimate goal is activism. So when someone would rise to the occasion and defend you, and you don't even have to do anything. I'm not sure we'll ever get there. Who knows? We'll see in maybe a couple of conferences from now. But this, of course, is a nice flow. It's up to you to look at your problem statement. What do you know about your HCPs or your patients? And where do you begin? You cannot possibly do all of these. You've probably done work in certain elements. But where do you feel the most urgent gaps? And that is ultimately how we then design our digital health solutions. Now, if we bring that back to the patients, we do a lot of research actually into patients. We do behavioral research, attitudinal research, information-seeking research. And then we actually get some of the insights that I'm going to share now. This is a model we use quite a lot. It's a very sort of rigid model around the phases of the patient journey. But as we've actually started calling it more and more, it's actually about people living with a chronic disease because they don't see themselves as patients. They have lives to live. They don't want to talk about their symptoms and the diseases all the time. It reminds them that they're a patient. These are people living with a chronic disease. And so that actually has some consequences. So yes, they want to learn more about the disease. They might actually be dealing with back pain or a headache or itch. So for them, it may not be a disease yet. So we have to think around what that means. That's where chatbots will come in. They want to be connected to a reliable care team. They don't just want the diagnosis. Getting a diagnosis is in some ways a relief, but in some ways also very scary. What does it mean? How specific is that diagnosis? So having a reliable care team is extremely important. It's definitely a need that we see. When it comes to management, they don't just want to be prescribed the medication. Actually, no. They want to live their lives. They want to find information and approaches beyond just the drug. What is our role? Is it us, or is it a partner, or is it actually a patient advocacy group? These are things we need to ask ourselves. Technology can do a lot, though, to create that connectivity there. When you think of adherence, it's not just the traditional compliance measures. Yes, we can do fantastic things, but how does that become a routine? If you constantly need to remind someone, are there ways where we can use actually cognitive behavioral approaches to actually build more of a routine that fits that individual? Because not everyone will do this in the same way. And then finally, the last stage of continuous care goes back to these chronic diseases. This is something that if you're 10 years down the road, maybe you're on a treatment that is actually doing really well, but you still need attention, you still need support. And then it's about staying as healthy as possible. And then the question is, okay, how broad do we make it? And you'll see some scenarios come through as I talk about chatbots. You can go really broad, but then you pick up a lot of content, a lot of responsibilities. You can stay more narrow and find partners to do the other things. So I'm not giving you all the answers, but I'm giving you a lot of questions. Sorry about that. Ultimately, though, this is definitely an answer. It's not only about the technology. The technology is there. Most things are possible, not always perfectly, but most things by now are possible. But then how do you effectively use data? How much data? Which data? Do you have it already, or do you need to collect it? And how do you connect it back to the people? It could be the people around them, the family members. It could be other patients, back to the clinic or in a patient support program. So these three are really important considerations. And before you do any, let's say, work on the technology design, you need to actually have these questions answered. So some of my thoughts around that, and I'll just go through them. Around the integrated part, it needs to be seamless. definitely tech to human is an important consideration. Also in moments where you need emotional support, for instance, chatbots are not very good at empathy at the moment. And then also make sure you're insights-based. Do you truly understand the problem that you're working on, and is it truly the most important one for the patient that you've identified? So make it part of our lives. Really try to not necessarily get them to always go back to somewhere where they don't feel comfortable. Make it not disruptive. How do you really connect digital and non-digital? People don't live digital lives. We have digital in our lives, so there are non-digital moments to consider. How can you connect them? It's not only the clinic, right? It's also just understanding what they go through beyond the digital part, and can we actually sometimes design for that? Where does technology just need to stop? You know, if someone is in an emotional crisis and dealing with acute anxiety, your chatbot is not going to fix that. They need to actually talk to a human. It's very important to really understand that. And then create personalized approaches, but you need to have the insights. You need to do the research. You need to have the data. Otherwise, you can begin an experiment, but before you scale that worldwide, it's probably you need to do a little more homework and try it out a bit more. So I promised to talk a little bit about chatbots, so I'll go through that. So I strongly believe in chatbots. At the same time, they're only another channel. But I think they have the potential to be a very powerful channel because they can be made quite smart. Still a long way to go, but still we're on our way. And ultimately, it's still software, of course. So you can control it, you can design it, you can work with it. It's a huge market. That's not only in healthcare. Obviously, chatbots are everywhere. I'll talk about that. And they can start creating that automatic engagement, and they can do it in a way that can be made to feel quite real and feel quite like a good conversation. And they can be used where the patients already are, so in social media and on websites and elsewhere. So when you look at the left, who thinks that they've engaged with a chatbot on one of those 4 options? Okay, that's not a lot of people. It's probably more of you, because if you've seen a pop-up window on a website with a little person like a bubble that wanted to talk to you, that is not always a customer service agent. That's often a chatbot. And you might even have noticed that sometimes there's a sort of a weird delay, and sometimes they'll actually tell you they're handing you over to an actual customer service agent because your question is too complex. So you might have been dealing with a chatbot. You might not have known it. So transparency is a big question as well. People should probably know. And you can see the growth of chatbots as well. This is how people, from some research, there's lots of research in this area, have said that they wanted to use it. And if you just look at the first 4, you can see very interesting areas already for us when it comes to health information, services, and support. You know, people are open to this opportunity. They are interested in what it can deliver. Their experience with it may not always be optimal, but this will improve over time. So I'm going to show you a concrete example. We've been working on Alia, our chatbot for patients, since 2017. We also have Quera, a chatbot for HCPs. I'm going to focus right now on Alia, and I'll introduce her with a short video. I hope I'm introducing her with a short video. Can we play the video? Yes.
At Novartis, patients have always been our priority, and we believe that everyone should be able to live a healthy life. That's why we've created Alia. Alia is a digital companion who offers support, which is tailored to your unique condition and personal needs. It empowers you to live a healthy life, one conversation at a time. You can choose topics or ask Alia specific questions. Alia will give you personalized answers straight away, ensuring you get information that's relevant to your specific needs. Because when you're dealing with a chronic condition, sometimes life can feel like more questions than answers. You can find Alia on a host of different social media, so wherever you are on your path of life with a chronic condition, she can be there for you. You can ask her whatever is on your mind, 24 hours a day. From diet and exercise to relationships and work, Alia can help to answer your questions and direct you to helpful articles and resources. Alia is there wherever you need her. Alia can help you track your symptoms and help you understand how they're affecting your daily life. Alia can even help you get the most out of your medical appointments. She can share tips for preparing for your visit and share ideas for useful topics to discuss with your doctor. Alia empowers you to live a healthier life. So, whatever the time, wherever you are, just ask Alia. Find out more at askalia.com.
So if you have Facebook Messenger, you can go to that website and just try it out for yourself. Do tell me what you think, because we're at version 3 and we're moving to version 4, so every feedback is welcome. And we, for instance, look every month. We look at, not directly, but we look at the conversations and we try to figure out where are the dead ends. And then we define new approaches, new content. So this is a journey from 2017. It's ongoing. Just to give you a short overview, and I'll speed up a little because I'm running out of time, but just to give you an idea of what to think around and what we've been thinking around. First contact, how do you introduce this? Make sure that people know it's a chatbot. You have to be very conscious of the creepy factor, as I call it. Don't pretend to be a human. Leverage the social communities. We have a lot of social media programs. We use those to really communicate around Alia. Start with closed-loop interactions, most likely. That's these sort of decision trees of conversations. But if you get to really big content, you can't do that anymore, and you actually need to move to free text input. So you can actually type in to Alia if you try it out, tell me about food, she'll take you to the food. Multilingual, because it's global. And then in the future, we're now moving to omni-channel. As already mentioned, that is the future, so web and other channels. And then we're moving into the really ambitious territory of profiling, because we're really going to move more into that actual cognitive behavioral space. And for that, we need data. It's going pretty well. Just a couple of numbers. I'm going to focus on 2. The 9% user retention peak. We want people to come back, because that means we're doing our job right and we're building conversations. Not every week, because that's not reality, but at least seeing how people come back is important for us, not necessarily only new users. And also how many messages are they actually sending back and forth, because it says something about those conversations. So I really agree with the previous speaker on know what you're looking for and what you actually care about. We're still on our way because we have a lot more to learn, but these are some early signs of interest. And now we're expanding. So Alia on the left is sort of the one you saw that's live. That's our starting point. One of the things we've also learned is it's interesting to go broad, but actually if you go more narrow, so the one in the middle is around hospital discharge for patients with heart failure. It's actually delivered through the clinics, less because the Alia on the left is through social media and search engine. The one in the middle is on the clinics. So that's a more narrow use case, because we know that's a critical phase in the journey of a heart failure patient. And also the one on the right is a great example of a new version that is actually focusing on trial recruitment. These, however, are all based on the same technology platform. They use taxonomy to be aligned, and we can actually repurpose elements of one chatbot to the next. So that's also things to consider when you start one of these. How can you actually create future versions? And then finally, something a little lighter. I think when you think around connectivity and interactivity and personalized, think around what are you trying to give someone? What is the surprise factor? So I would like them to be seamlessly connected to our chatbot, to be really stunned by the level of interactivity, and then ultimately to really be surprised about how personalized we've been able to make it. Thank you very much. Thank you.
Excellent. Very, very good. Okay, thank you very much. Let's take questions.